this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Hey everybody, welcome to a special edition of Pick Dr. Osborne's Brain. It's a pre-Thanksgiving edition. I'd like to say happy holidays to you all. Happy Thanksgiving. I hope your coming up week and festivities is fantastically wonderful and gluten-free. And so we're not doing a show this Thursday, a live Q&A this Thursday, so we thought we'd move it up to Tuesday and give you guys some answers to questions that might be burning on your mind and heart. And so if you've got those questions, go ahead and punch those into the feed now. Make sure you smash that like button. If you're not subscribed, make sure you hit that subscribe button as well. And let's dive in. So first question tonight, are peanuts gluten-free? Oh, where'd it go? Okay, are peanuts gluten-free or allowed or taboo for any reason? They can be. So peanuts are gluten-free technically, but you can get some brands of peanut butter that are cross-contaminated. And that's what you have to be the most careful of is that you're buying a brand that is got in a dedicated facility that doesn't also, process wheat, because many of the factories that process peanut butter can also process wheat, and so there's a risk of cross-contamination. That being said, peanuts can be high in aflatoxin, which is a particular type of mold toxin that for many can make them sick. And so in that regard, peanuts in excess can potentially create a problem. Doesn't mean they necessarily do for everyone. If you buy a good, reputable brand of peanut butter, particularly organic peanut butter, you go a long way to helping yourself alleviate some of that risk. We have an article, I think, maybe we do or maybe we don't, on Gluten-Free Society. I'm fairly certain that we do because I wrote it. And if it's not published yet, it might be scheduled to go up, sometime later this week. Actually, it's a new topic that we actually covered. So if we have that, we'll post that for you. And if not, check in at Gluten-Free Society here in the next week or so and just type in peanut butter in the search engine and you'll be able to pull that up. Let's see, Lynn's asking, what's the best enzyme to get rid of biofilm from mold in the gut? There's not a best. There are several different types of enzymes that can be used. There's no great way to analyze biofilm enzymatic breakdown outside of a lab, and so there are a number of different what are called proteolytic enzymes that can be used. I mean, my favorite formula that I personally use in my practice is a compound called matrizyme, M-A-T-R-I-Z-Y-M-E, and so that's a mixture of different types of proteolytic enzymes that have strong affinities for the capacity to break down biofilm, and that may be something you want to check out. And we can put a link up to that for you, Lynn, if you'd like. Mary asks, does low thyroid cause high LDL cholesterol, and how do we know? There's some that say that yes, that low LDL or that low thyroid hormone production causes an elevation, can cause an elevation in LDL cholesterol. I'm more of the followers or the scientific belief system that LDL cholesterol is the least of anyone's worries. Like the whole thing on cholesterol, we did an entire show, Mary. Maybe we can put that cholesterol myth show link up for Mary on Facebook. You should watch that show on cholesterol and the cholesterol myth, and then maybe come back and re-ask your question in a different way if you're still worried. But I think I don't have time to get into the entire story of the history of cholesterol, but just very briefly, LDL cholesterol won a Nobel Prize in Medicine in 1998 because it was found to be so critical for the formation of nerve synapses. And this is one of the reasons why people, when they artificially try to lower their cholesterol, have neurological damage, neuropathy and myalgias and other of the symptoms associated with reduction of LDL to a too great of a level. LDL is very important. Your body needs it. And so suppressing it, in my opinion, is an extremely bad idea. Eileen's asking, how do steroids damage the body, and what's the long-term damage? So if you're talking about injectable steroids, the injection site where the steroid goes in, generally a doctor's like, if you have a knee problem or shoulder problem, they want to inject you with a corticosteroid. Usually the doctor is going to limit you to 3 injections only. And the reason why is that most doctors understand that When you inject steroids directly into a joint or tissue, you increase the risk of damaging that tissue irreparably. There's something called osteonecrosis, which is death of the bone around that joint that can occur. It's a side effect of injectable steroids. Now, I'm not saying it happens to everyone, but the risk is greater the more times you do it. And so that's one of the very potential drawbacks to just randomly getting steroid injections at every pain that crops up. And some doctors do that. I've seen some doctors that I would say that's malpractice. Like, you shouldn't be injecting everybody with steroids all the time. That's ridiculous, because you increase that risk of death of the bone and death of the cartilage tissue. So that's the injectable. If you're talking about oral steroids, the long-term risk is diabetes, elevations in blood pressure, elevations in blood sugar, weight gain, obesity, water retention, and B vitamin deficiencies combined with vitamin C and calcium and magnesium deficiency. So that's not a short list. Long-term oral steroids are one of the most detrimental forms of medical therapy. And this is why, again, most good doctors will tell you if they're going to put you on a steroid, they do it for a short period of time. They usually do like what's called a dose pack, where it's maybe 10 days of a steroid and a taper down and getting you off of it as quickly as possible, as opposed to using a steroid, indefinitely for long periods of time as a pain management drug. Because I've seen it. Some doctors, they use the steroid like a pain management drug, which is a terrible idea. Let's see here. I'm not sure. Okay, so Mia's asking about C60. And are you talking about carbon? Are you talking about charcoal or carbon, Mia? Because I need to get clarity on your question before I can answer you. Let's see. 30 years ago, I had a large dark mole surgically removed from my face. The past 2 years, the tiny ones began growing in its place. Apart from surgery, is there anything I can do to get rid of or prevent them? If it's actually truly a mole, not really. You can attempt the soaking in peroxide. Some skin lesions, respond really well to a peroxide soak and scrape, but a true mole, generally not so much. So Penny wants to know, what foods should one consume after a bout of diarrhea due to food poisoning? There's not like a specific diet beyond food poisoning that as far as foods that are better or foods that are worse. I think you take it by what your gut is capable of tolerating. A lot of times after food poisoning, you either have a diarrheal or a vomiting purge, and so your gut's already kind of been cleared out of the poison. And so, what some people find is just maybe a liquid fast for about a day. Liquid, you could do bone broth, or you could do, meat broths or vegetable broths, and you give your gut a little bit of rest, and then try to just reintroduce slowly real food back in. But there's not like a specific diet coming back from food poisoning. I would say one of the best things that you can do to support your microbiome is to take a really strong probiotic. I mean, the one I would use in that situation, if I had food poisoning, I would use a probiotic called Ultrabiotic Defense, and it's a very strong amount of CFUs, so it's several 100 billion colony-forming units of very robust bifidobacterium and lactobacillus. See, Amelie saying, my mom was very high HDL, 190. Is that okay? It's not unokay. Also, she has a good appetite, but just can't put on weight and is way too underweight. The doctor checked her blood and cancer markers, but all was normal. I mean, you could look at her from a caloric perspective. She may have a healthy appetite, but she still may not be hitting the mark for her caloric need. It's hard for me to give you specifics because I don't know her height, I don't know her weight, and I don't know much else about her other than she has high HDL at 190, which I wouldn't be concerned by. But I would look at protein calories, and I would look at total calories, and then I would adjust that first to see if we could get weight. Beyond that, you have to look at if they're getting enough calories. If calories are not the issue, then you have to look at the quality of the calories. Some people are eating calories they're allergic to or that they're sensitive to, and so the calorie itself is actually a poison. that's taxing the immune system and taxing the protein of the body. And so the body actually starts breaking down muscle tissue to sequester protein to help fight the food that they're eating, and so they can never put on weight. We see this commonly in the elderly, but we also see this commonly in children. And it's in kids and in infants, we call it failure to thrive. It's when they're generally, what causes that is they're eating, and a lot of times gluten causes it. They're eating gluten, and gluten instead of being food is poison, so it's poisoning them. It's not nourishing them. And so when people aren't able to gain weight when they're eating enough calories, it's generally what they're eating. Do I need a special protocol to eliminate mycotoxins from my system? Laura's asking. Possibly yes, Laura. The number one rule of doing a mycotoxin elimination protocol is to make sure first and foremost that you're no longer in the mold and no longer being exposed to the mycotoxins, because any protocol that you do, the success is contingent upon you not being in it. Beyond that, there are a few different things that I like to recommend. One of them is called MycoBinder, and it's a blended formula with a number of different types of binding agents that help support the binding of mycotoxins. Number two is NAC, N-acetylcysteine. Excuse me. NAC is very beneficial for supporting the liver's capacity to convert mycotoxins, which are fat-soluble substances, into water-soluble toxins so that you can pee them out and sweat them out. And your body has the ability to excrete them, because when they're in their fat-soluble form, it's a much harder task for your body to get rid of. And then also, one of the things I like to use is a strong, solid probiotic, because when you're trying to get rid of mycotoxins, it's very important to support the growth and the health of the microbiome, because many of the bacteria that naturally thrive in the human GI tract actually have been shown to denature mycotoxins. And so your own microbiome can help you get rid of mycotoxins if it's healthy. And so a good probiotic, I personally like to use either Ultrabiotic Defense or another formula that I have called Biotic Defense with S. Boulardii. But those two are my preferred in a mycotoxin detox protocol. Okay. Best low vitamin K foods for someone who had a brain stem stroke a month ago and is now taking 4 pharma meds, including warfarin. Warfarin, by the way, is an anticoagulant that inhibits vitamin K. Good question, Sheila. I don't recommend. First of all, I can't give you medical advice, so I just have to say that, CYA. But two, I don't agree with using vitamin K antagonists for somebody who's had that type of scenario. I more agree in looking at factors that are important and necessary to understand about the quality of the blood, because if there was a clot that created a problem, you have to determine that, and no amount of blood thinning medication is ever going to fix that. And you can't inhibit vitamin K indefinitely, because vitamin K is an essential nutrient. Without it, your body is going to deteriorate. You need vitamin K to fight cancer. You need vitamin K to get calcium and other minerals into your bone. So vitamin K is a very important nutrient beyond its clotting cascade function. And so I got to just say I don't agree with that philosophy. Now that being said, what can you measure? What can you ask your doctor to measure to help you understand the viscosity or the coagulability of the blood? You can ask your doctor to measure D-dimer, which is a marker when elevated is an indicator of microclotting of the blood. You can ask them to measure fibrinogen, which is a marker of when fibrinogen is high, it's also an indicator that blood is quick or easy to clot. You can ask your doctor to measure your prothrombin time and your INR. These are markers that help understand the clotting speed of the blood. Again, they're all important to understand the general nature of whether or not the blood is overclotting or rapidly clotting, which increases the risk for strokes and heart attacks. The other thing I would ask to measure would be a full spectrum of nutrients, because there are natural things that we need that are essential, like magnesium, for example, is a natural antiplatelet aggregator. So magnesium deficiency can actually cause your platelets to clump more aggressively. So you need magnesium to prevent excessive clotting. And it's an essential nutrient, whereas warfarin is not an essential nutrient. It's a poison that was derived from rat poison that was found to create anticoagulative effects in the blood. I would have them measure your omega-3 status. Omega-3s can naturally thin the blood. There are other natural options that you could talk to your doctor about. You could talk to them about ginkgo biloba, which naturally thins the blood. So you can talk to them about proteolytic enzymes, which naturally thin the blood and prevent aggressive clotting. So these are all options. So I would never, if it were me, again, I can only tell you what I would do, but if it were me and I was faced with a stroke, I would never go on those different medications that were all for all intents and purposes, in my opinion, poisons and not solutions. I would look for the solutions. I would look for asking the right question, which is, why did my blood clot so aggressively that it would lead to that type of issue or problem? What am I doing wrong that I could change, or what am I not taking that I could be taking? What nutrients am I lacking that I should be using? What foods am I eating that are potentially causing inflammation, that are increasing the risk for my blood to clot? Like, those would be the answers that I would be seeking, as opposed to trying to get around taking low vitamin K. I would never starve my body of an essential nutrient for the fear that it might interact with a drug that's not solving the actual problem that I have. That, again, it's a philosophical difference. I know it doesn't answer your question exactly, but I feel pretty strongly about that. Why do doctors prescribe statins to lower cholesterol? Yeah, because there's the myth that cholesterol causes heart disease. I can't answer you what other doctors are thinking per se, but as a general rule of thumb, the vast majority of medicine believes that cholesterol is an enemy. In fact, I don't believe that to be true at all, and I think the science is going to bear that out, and already really, honestly, has borne that out over the years. Can pins and needles be attributed to with B vitamin deficiency, or is it just nerve damage from eating natural sugars? Is it possible for the nerves to heal? So yes. Pins and needles, neuropathy, can be associated with B vitamin deficiency, particularly B12, B6, B1, and folate. Those particular B vitamins are notorious, and B5 can all cause pins and needle neuropathy. Beyond the diabetic neuropathy that oftentimes gets diagnosed from people who are over-consuming sugar. And a lot of diabetic neuropathy are caused not so much even by the diabetes as much as they're caused by the medicines used to treat diabetes. Understand the main medicine used to treat high blood sugar is metformin, and metformin inhibits CoQ10, B12, and folate. Those three nutrients, when deficient, can cause neuropathy. So there's some people that believe that diabetic neuropathy is actually a manifestation of metformin-induced nutritional deficiency that leads to nerve damage. Can sugar cause neuropathy? Yes, I think it's both. I think it's a combination of diabetics with uncontrolled blood sugar where the sugar's doing damage to the nerve. I think it's a combination of the medicine causing drug-induced nutritional deficiencies leading to the potential of B vitamin and CoQ10-induced neuropathy, deficiency-induced neuropathy. And so the answer to your other question, is it possible for nerves to heal? Yes. It's possible for any part of your body to heal. You just have to quit doing things that are causing the damage, right? That's the big question that should be being asked by every doctor, but very rarely gets asked by any. I had a genetic test 24 years ago from Interolab. The result was homozygous DQ2. Can I trust that result? Yes, you can. You can absolutely. If you were homozygous for DQ2, that means you have 2 genetic alleles for DQ2 on your beta-1 gene, because that's what Interolab tests. And that's a positive result. So if you went gluten-free, based on that result, you did the right thing, in my opinion, regardless of whether you have celiac disease, because people with DQ2, 99% of the people with 99% of the people with celiac disease have a DQ2 or a DQ8. But there's a large percentage of people that have DQ2 and DQ8 that never develop celiac disease. And so you have to understand that gluten is a slow poison. Over your lifetime, the more of it that you eat, the more damage that it can do. The more damage has the potential to lead to an autoimmune response in your gut or other places in your body. And if you're genetically positive for gluten sensitivity, it's a great idea to discontinue the consumption of gluten, because if your body recognizes it as a foreign invader, you certainly don't want to eat it on a regular basis, because that's how the inflammatory damage occurs. And then, again, multiplied out over years, and you can end up developing not just celiac, but a host of different types of inflammatory autoimmune problems. Let's see, Joan asks, Dr. Osborne, can you suggest another flour other than almond flour? I cannot eat almonds. Cassava flour was not a favorite of yours either. No, I don't mind cassava. I just think that you have to be cautious with the consumption of it because it's very, very high carbohydrate. And so what a lot of people do is they try to replace everything that was bred in their life with something, wheat or barley or rye, etc., with cassava. And what ends up happening is they end up over-consuming carbohydrates. Cassava, tapioca, arrowroot, there's green banana flour, there's chestnut flour. Can we put the flour article up for Joan? Joan, you might check this article out, and that there's about 8 really solid flours that are possible to consume even beyond the almond flour that might be better fits for you. Yeah, so Kat asks, hi Dr. O, are you familiar with coronary screening tests that MDs are promoting? I'm 63, healthy except for gut issues, now healing, and my scan came back with right, I'm going to assume you mean carotid artery, the right artery 70% calcified. Thoughts? Yeah, those tests are good. In my opinion, they're better tests than looking at cholesterol, because you could have cholesterol that's high and you perfectly clean arteries, in which case, why would you want to lower it? And then you can have cholesterol that's normal and come back and you've got 70% calcification in a carotid. And that's if that's the case, what that's really indicative of, Kat, is that you have some degree of vascular inflammation. The reason why arteries become calcified is because they're first inflamed. Something is inflaming them, whether it's food or whether it's environmental poisons or whether it's other things. That the inflammation in the blood vessels themselves leads to damage that the body responds to by trying to lay down minerals like calcium, not just calcium, but calcium and fat. So your body's trying to really deposit those things into that damaged area as a stopgap to put the inflammation out. And if you don't solve for the inflammation, then you keep laying down that calcium, those other minerals, and that fat, and you end up with occlusions. You end up with space-occupying plaque formation that basically creates a space-occupying component to that blood vessel, which, so if they're saying it's 70% occluded, that means you've got some work to do. One of the best things to do in that situation, naturally, again, your doctor's probably going to want to put you on statins. They're probably going to want you, just because you have that occlusion, they're probably going to want to keep you on blood thinners and maybe keep you on aspirin. That's pretty typical advice in my experience. But one of the things I like to use to support people is proteolytic enzymes and niacin. There's animal studies that show niacin can actually break plaque formation down in arterial linings. Again, there's no great human studies on that, but there's animal studies. It's actually how we discovered some of the benefits of niacin originally. But it's the flushing version of niacin, not the no flush. So there's niacin, which is vitamin B3, and there's niacinamide, which is the no flush version of niacin. It doesn't work as well in that type of situation as pure niacin does. Now, a lot of you have been asking on the topic of vitamin B3 and niacin. There was a recent article published across the web that there's a special type of niacin that was done. There was a small-scale animal trial where they found an increased risk for cancer. And so I've been getting flooded with this question, does regular niacin or regular B3 increase the risk of cancer? No, it does not. And I would even say that we don't even know whether that altered version of B3 increases the risk of cancer. This is based on one minor, very small study that has not been reconfirmed and it has not been validated by additional research. So a lot of the news outlets are making a much bigger deal of this than what they should be making. Let's see, Mary says, I'm allergic to molds. What foods do I avoid besides nuts? I have a device that when you put the food on it kills mold. I don't know that I could understand what that device would be. You don't generally kill the mold on food by putting it on a device. Some people try to use UV lights or ozone on the food, but none of those things are going to be super effective. If your food is moldy, don't eat it. But foods that have the potential to be moldy, aside from nuts, mostly older leftovers that have been left over too long. Milk can be a contaminated source of not mold so much as mycotoxins if you're doing any kind of dairy at all, depending on what the animals eat. This is one of the reasons why if a person does dairy, should never be, standard feedlot dairy where the cows are being fed genetically modified grains with the potential for mold contamination and mycotoxins, because we know mycotoxins show up in the milk. And so that would be another area. Other common sources of mold in food, again, a lot of it is how long it's preserved or attempted to preserve. So it's the age of the food more than it is truly any specific food outside of coffee, peanuts, and other ground nuts. But even ground nuts are not tremendously contaminated because they have a hard outer shell generally that protects them. And your tree nuts, not the worst risk for mold exposure. Russ asks, have I done a show on enzymes? I assume you mean bromelain. I don't know what that, may be a typo there. No, I haven't done a show specifically on enzymes. Maybe we'll put that in the queue. Mario asks, what can be the cause of soreness and inflammation in the soles of the feet, causing discomfort when walking, mainly even on her side when a woman's on her cycle? So I'm assuming that this pain gets worse, cyclically speaking. This is going to commonly be a burning foot neuropathy, like a B vitamin. I would start with a B complex. And then I would also look at the physical aspect of the heel and the calf and the plantar fascia, because sometimes what happens is those tissues become very, very tight. And this is true. I see this especially true of women, just my experience. Women generally like to tuck the sheets in at the base of the bed because it keeps a tidy home. Men don't. Men will kick the sheets out. They want their feet up above, because if they put their feet down in a tucked bed, then it points the toe. So it points the toe, and what happens when that toe is pointed all night during sleep is it tightens that calf, the gastroc and the soleus muscle. And that understand that those muscles they attach to the Achilles tendon, especially the gastrocnemius attaches to the Achilles tendon, which wraps around the heel of the foot and pulls and puts pressure on the fascia. And so if you're sleeping like that every night, you're creating a physical tightening of that tissue that becomes predisposed to injury and pain and inflammation when walking. And that's a physical, not a biochemical reason. Now, certainly nutrient deficiencies like B vitamins can contribute to it. Calcium and magnesium deficiency may be contributing to it, but untuck those bed sheets at the base of the bed and let your feet sit in a natural position, not in a forced plantar flex position. Is it true that in order to benefit from vitamin D, it must be taken with magnesium? No, it's not true. It's not true at all. I don't know who's saying that. We get that question quite a bit, though. Same thing with vitamin K. It's you don't have to take them together. Some would argue that it's smart to take them together, but it's not necessary. One of the things that has led me to that conclusion is that in everybody I ever put magnesium or vitamin D or vitamin K or any other nutrient on, we do it through testing, right? We do it by testing their levels to see what they don't have versus what they do have, so that we have an accurate representation of what they need versus what they don't. And that's why I feel that way. Now, if you're just randomly trying to take different supplements, it's not necessarily a bad idea to take them together, because they do have synergism and they do work together. But again, the fact of the matter is it's not always necessary, and in most cases, in my experience, it's not. Sue asks or says, I had to have a 2-level cervical fusion, recovering without issues. What can I resume, or when can I resume a detox, fairly intense detox of each organ with binders? Opened all my drainage channels first, had to pause for surgery, want to be sure I fuse. I'm not sure I understand your question. I understand that you had a fusion, I understand that you're trying to recover, and I understand that you're trying to implement or re-implement detox without it interfering with your surgery recovery, but I'm not understanding why you actually want to do a detox while you're trying to recover from surgery. If you're trying to recover from surgery, Sue, check out our post-surgical nutritional protocol and do that first. And actually, we'll post a link in the feed for you. I think we have that, Mel, on GFS. Let's see here. What does it mean to have a low white blood cell and albumin glucagon ratio levels high? So I don't know how you're getting your glucagon measured, but that's not a typical test. So clarify for me, Williams, that you're actually measuring albumin glucagon ratio. Typically the ratio that's measured in blood work is albumin globulin, and if that's a typo, that's an important typo, because glucagon is very different than globulin. But if you have a low white blood cell count, it basically means that something is probably creating an immunosuppression in your erythropoietic and your stem cells in your bone marrow are what produce your white blood cells. And there are a number of different environmental poisons and chemicals that can interfere with the stem cell production that leads to white blood cells. And so one of the most common reasons we see for that is gluten exposure. So if you're not gluten-free, you might look at getting that checked out. The other really common one is mold. Toxic environmental mold exposure can cause white blood cell counts to be low on standard labs. And so if you're living in a moldy home, for example, that would be a prime example of why you could have a high white count along with a high albumin globulin ratio. Butisse is asking about products for cancer. So I want to just be very clear, Butisse. None of my products are designed or aimed at treating cancer. If you know me for any length of time, you already know my philosophy on treatment and diagnosis, which I'm not a fan of either one of those methodologies, really. I'm more of a fan of supporting the body with what it needs, because your body has the power to fight cancer cells. There's actually a name for it. Scientifically, it's called apoptosis. Apoptosis means programmed cell death. So if somebody's got cancer, one of the most effective ways to get the body to turn up apoptosis of cancer cells is fasting. It's one of the most effective ways. Now, you can't fast forever, so you can't fast the cancer. You can't starve yourself to death before you starve a cancer. But you can certainly implement intermittent fasting strategies and 24 and 48 and 72-hour fasting strategies. And for that, I would say get with a practitioner who understands really good fasting, without sending you into a calorie deprivation, because you don't also, if you have a cancer, you don't want to undereat to such a degree that you don't provide the nutrients your body needs to fight it and regulate it. But there are other nutrients required for apoptosis of cancer cells. Vitamin D and vitamin K is another reason why earlier I was talking about warfarin and saying I'm not a fan, because vitamin K provides apoptotic effects on cancer cells. Vitamin A does, vitamin C does. There are a number of different nutrients. So if you're dealing with cancer, now is not the time to like throw a shotgun approach at a bunch of different supplements and hope that something sticks. You really want to work with somebody who understands the metabolism of cancer cells and the biology, the biochemistry of cancer cells, so that you can get a strategy that's uniquely designed for you that supports you in the best possible way. Let's see, there's a question about myasthenia gravis, but the question doesn't make sense, because I think you just don't have the understanding of what. So myasthenia gravis is an autoimmune response, and there's a couple different ways you can develop it. You can have antibodies that you develop against acetylcholine receptors, which are the receptors that receive the neurotransmitter acetylcholine, which is the chemical that your nervous system produces to talk to your muscles. And so you can have antibodies against the receptors for acetylcholine. You can also have acetylcholine antibodies directly. So it's not an enzyme issue. So that's why I say, the question asks about if you don't have the enzyme for it, you've asked that question incorrectly, because that doesn't make sense. But if you were suspected to have myasthenia gravis and you don't have the antibodies, maybe instead of enzyme, maybe you meant to say antibodies. Again, I don't want to put words in your mouth. You have to understand that antibody tests to measure for autoimmune diseases are limited based on the immune system itself. So certain antibodies you can have deficiencies of certain antibodies. And if you have a deficiency of an antibody like IgG or IgA, and the doctor is using IgG-based tests to measure your autoimmune antibodies, you can get a false negative. It doesn't mean you don't have that disease. It just means that the test result was inaccurate, not because, again, for any other reason than you just don't produce enough antibodies for it to generate a positive response. So there's a lot to unpack in that question. If you don't know biochemistry really well, it's going to be a confusing answer for you. Suzanne, can gluten-sensitive or even celiac cause a JAX2 mutation leading to high platelets? I wouldn't say they cause a JAX2 mutation. That's more, JAX2 mutation is more of a genetic issue. But they can certainly affect the function of that enzyme system, and so in that protein system. So I've seen cases where gluten induced platelet problems through that, but not necessarily that it causes the genetic mutation. So again, there's testing for JAX2, that genetic testing you can have done that can identify, variants or mutations in that gene. And then there's also, toxicities in the environment that can influence the way that gene propagates and works, which they're not the same thing. And so again, gluten's not going to cause the mutation, but it can cause the dysfunction. Let's see here. So Christy asks, she says, iodine's important for the body, especially the thyroid. Why are some people allergic to iodine? Is this possible? I have a few friends who say they are and have a low functioning thyroid. No, it's impossible to be allergic to iodine. Where most people think they're allergic to iodine is that they have some kind of shellfish reaction. So they're actually allergic to shellfish, which is a source of iodine, but not the cause of the allergic reaction. Or they've gone in to have some type of advanced imaging tests where they've had radioactive iodine, where they've been given radioactive iodine, and so they're not necessarily reacting to the iodine from that test, they're reacting to the radioactive nature of it. But iodine's an essential nutrient, and you can't be allergic to an essential nutrient because an essential nutrient, by definition, is required for the body's essential functions. And when you are deficient for long enough in any essential nutrient, it can cause disease and death. Right, so it's impossible to be allergic to iodine. It is possible to be allergic to iodine-rich foods that sometimes get mistaken as iodine allergies, like shellfish, and it's possible that a person has had an iodine bolus given to them for an imaging study where they reacted to the radioactive material, but not necessarily were they allergic to iodine. I see that all the time too, and I'm glad you asked the question. Please share a little bit about how having a sleep window of 8 hours is beneficial for a person with a gluten, grain-free diet or lifestyle. I would take out that last segment. I'd say, please share a little bit about how having a sleep hour of eight hours is beneficial for a person, period. Whether you're on a gluten-free, grain-free diet or lifestyle or not, sleep is critical. Sleep is one of the non-negotiable 7 fundamentals of health restoration and health maintenance, okay? Because sleep deprivation kills, right? It's a form of stress, like ultimately a form of chemical and emotional stress that will deteriorate the body. And so there's a very important need for humans to sleep. Now, not everybody needs exactly 8 hours, but as a general rule of thumb, what we do recognize is there's a window where sleep is more critical than at any other time for healing and repair, and that window is 10 p.m. to 2 a.m. And so what a lot of people do is, they go to bed too late. They go to bed at midnight, so they're missing 2 of the 4 hours of that 10 to 2 window, or 10 to 2 window. So they're missing half of it, and so their recovery and their repair is not as great. And you don't make that time up by sleeping longer. So you could go to bed at midnight and sleep till noon the next day, but you're still not maximizing the restorative hours and potential of your sleep to regulate your circadian rhythm so that you're healthy. So sleep, is important for everyone. That 10 to 2 time frame is the most important. 6 to 10 hours of sleep, depending on your lifestyle and what your situation is. I can get by on 6 hours, but I do better with 8. And that's true of many people that I've cared for. Some people need more when they're in their healing phase early on. So like maybe they've got a history of autoimmunity and inflammation and their bodies are trying to heal. And so the sleep is reparative and restorative for them. And so sleeping more is better. Some people have heavy aggressive exercise programs, and so they need more sleep. If you ever talk to a professional athlete or an Olympian, a big part of their training schedule is sleep. Like that is scheduled into the program. They don't work out aggressive, extensive hours without actually sleeping adequately because they won't recover. So sleep's important for everyone. 10 to 2 is the most important time frame, but preferably go to bed earlier than 10 and stay asleep longer than 2 and shoot for 8 hours as a general rule of thumb. Thoughts on hormone replacement therapy, Dion wants to know, for postmenopausal women, safe or not? I think it's safe if it's monitored. I think some women benefit tremendously from it, and I think other women are put on it as a cure-all for, whatever ails them by a doctor who is not investigative enough. Like I see a lot of women get put on hormones that really don't need hormones. But the doctor said, well, we're going to treat your symptoms with hormones even though your hormone levels aren't low. That to me is dangerous. That to me is not something that doctors should do. But if you're having your levels monitored and, and when I say monitored, I mean an initial evaluation followed by a recommendation or a prescription for that. And then your doctor has you come back in periodically. At first, ideally every 3 months, just to get an idea for how they're working. And then as time goes on, you can get away with every 6 to 12 months as far as a monitoring component. But I'm not against them. I'm just not for them universally for everyone, especially if a woman's had a history of certain types of estrogen positive or estrogen related cancers. Then there's caution that needs to be taken. There are unique situations where you have to be careful. Hi from Australia. Don't feel best when I eat wheat, but when I eat corn, I feel good. Does this have anything to do with my ancestry? It's too general of a question. One of the things that we know about gluten-based proteins is that they can be broken down into morphine-like compounds, and so some people actually, when they eat them, do feel better. And there's some research that actually I think we have a paper on this called "Gluten Can Mask Its Own Toxicity." And this is the way it does that, is it actually breaks down into morphine-like components that do make us feel good when we eat them. And so that may be your reaction to corn, not necessarily your ancestry. If we look at, just looking at your last name here as Henriquez, I'm assuming you're Latino, whether that's Hispanic or South American or whatever, because you live in Australia, hard to make that determination. But we see rates of gluten sensitivity, including to corn gluten, that are just as high in that ancestry as we do in any other form of ancestry. It's not, just because there's the historical perspective of corn and maize being a primary staple food in South America, doesn't necessarily mean it was the right thing to do. We have a lot of historical malnutrition stemming from that practice as well. So I don't know why you're feeling better when you eat corn, other than you might have that morphine-like breakdown issue. But if you're curious as to whether or not you should be gluten-free, completely gluten-free, meaning grain-free, I would get tested to get that confirmation so that there's no question about what you should be doing. Jacqueline wants to know, what would be a great breakfast if bar is gluten-free for someone who is always constipated? Oh, breakfast, I said, no. What would be a great breakfast bar? Not breakfast if bar, but breakfast bar that's gluten-free for someone who is always constipated. Also, does gluten mess with your hormones? Yes, gluten messes with your hormones. We can post the hormone, gluten in your hormones article below that question and give you a more comprehensive, in-depth evaluation of that question. But breakfast bars, if you're talking about like a processed breakfast bar, not a huge fan. If you're going to do something, In that regard, I would just encourage you more to eat real food, especially if you're constipated, than eating a processed bar. Because a lot of those processed bars, depending on what they're made out of, I mean, there are a number of, there's thousands of different varieties on the market. The vast majority of them that I've ever looked at or reviewed are not super great. So not really one I would say to do over real food in the morning. Mary says, I bought the Warrior Bread but did not get all those wonderful recipes you just mentioned. Everything sounds wonderful that you mentioned to make. Looking forward to making this. So if you didn't get those recipes, Mary, reach out to glutenology@gmail.com and just let our customer service representative there know that you didn't get those and that you would like to get those, and they'll send them right over to you. Okay, so Julie is saying, I will receive the kit I ordered to test and see if I have gluten sensitivity. In the meantime, I'm assuming I do have gluten sensitivity based on what I've learned in the glutenology class and in No Grain, No Pain. I'm checking labels on everything and discarding any product in my house that has grain-based ingredients. Am I correct in tossing a zinc supplement that has zinc from brown rice chelate? Yes. Also, should I toss a vitamin D soft gel that has safflower oil? Not necessarily. Vitamin D has to have a carrier oil, and generally speaking, it's a non-saturated carrier oil, because if you used a saturated carrier oil, it wouldn't properly emulsify and distribute. So safflower oil is not a horrible option for a vitamin D emulsion. So not necessarily that, but definitely I would toss the brown rice chelate zinc. How about ubiquinol that has caramel liquid color? So caramel can be made from different things. I think we actually have an article on caramel on Gluten Free Society. This is the question you have to ask the manufacturer, because some caramel is made from wheat, some is made from corn, and some is, you can sometimes get it from maltodextrin, tapioca. And so some are okay and some are not okay. So it just depends on, which caramel that product is deriving its color from. So that would be the determining factor, and that you would call the manufacturer to ask. I'm not sure, Ashley, I understand your question. I had IBD, okay, I had an irritable or an inflammatory bowel disease. Is it irritable or inflammatory bowel disease serum test? And everything was negative except Saccharomyces cerevisiae, which was slightly elevated. What kind of test? Is it an antibody test? Were they measuring antibodies against Saccharomyces cerevisiae? I was told it's normal. Should I have more tests done to confirm I have IBD or autoimmunity? Again, clarify irritable bowel disease versus inflammatory bowel disease, and clarify specifically what was actually measured, because there are a lot of different blood tests that can be used to try to understand inflammatory bowel disease, but also irritable bowel, and so I'm not quite sure which direction I need to go for your answer. Let's see, Natalia, I have no anti-gliadin IgG, but some anti-gliadin IgA. Am I being exposed to gluten? Yes. Especially if you think you've been gluten-free for 10 years. If you still have antibodies, IgA antibodies to gliadin, you are definitely being cross-contaminated or being exposed if you've been gluten-free for 10 years. Now, Natalia, I would also ask the question, are you true gluten-free? And if you're not quite sure what that means, check out No Grain, No Pain. But at the end of the day, a lot of foods, even that are labeled gluten-free, have the high tendency to be cross-contaminated with enough gluten to create a persistent antibody elevation. And I see this all the time. Now, also know that there are other things that can cross-react with gluten antibodies, and so you may not necessarily be exposed to gluten, but you could also, mold is an example of people that environmental mold will sometimes have a crossover reaction that falsely elevates their gliadin antibody levels, and so that is another possibility, but hard to say without more information. What test should I get done to know if my thyroid function was because of gluten? Thyroid is such a comprehensive and complex thing, Lynn. There's 17 nutrients that you need for your thyroid hormone to properly be regulated and metabolized, and so those should all be measured. But there's not like a specific test that says, if this test is positive, your thyroid disease is because of gluten. The true test is, if one of the types of thyroid disease that gluten can cause is something called Hashimoto's, which is an autoimmune reaction. And so Hashimoto's antibodies can be checked. There are two main antibodies. There's thyroid peroxidase, TPO, and then there's another one called antithyroglobulin. And so sometimes what people find when they're going on a gluten-free diet and they have Hashimoto's, they find that when they get their antibody levels rechecked after being gluten-free, that their antibody levels for Hashimoto's start to deteriorate, start to basically drop and go away. That really is the definitive way to know whether or not gluten is the cause, if we're talking about autoimmune thyroid disease, is monitoring your antibodies as you go gluten-free to see if there's a correlation between the diet change and the drop in antibody levels. So hopefully that answers your question. Is there a dietary deficiency for someone who has chronically weaker nails? I have two that almost always split once they grow a bit. A lot of them, Mary, there's selenium, there's iron, calcium, zinc deficiency, there's a biotin deficiency and other B vitamin like vitamin B2, vitamin B3 deficiencies that can do that. So I mean, it's not just one. This is why you guys, week after week, you hear me talk about the importance of comprehensive nutritional testing when you're struggling with symptoms that your doctor doesn't understand and that you don't understand why they exist. Because nutrients are a foundation, they are a fundamental need that the body has in order to function properly. And so loss of function or deterioration in function is oftentimes seen when micronutrient levels are falling. So not knowing and not getting those measured periodically sets you up, in my opinion, for greater risk of the development of chronic degenerative diseases as you age, including hair and nails being more brittle, more weak, and not growing effectively. Let's see, scroll down on the left side just a little. Okay, Kelly's asking, I have a UTI with strep. My NP wants me to take a Z-Pak. What could I take instead of antibiotics? Look, it's hard for me to give you guidance there because that, I don't know what the nature of your UTIs or how severe it is, and I don't want to steer you in a wrong direction or give you medical advice. But I would say if you're trying to support your urinary tract, I'm not telling you not to take the antibiotic. I would just say it would not be a bad idea to take a high-dose probiotic, something like, again, like Ultrabiotic Defense. And then there's also a sugar derivative of cranberry called D-mannose, which is a natural way to help your kidneys cleanse. So that would be something else that I would encourage you to look at. We actually have something called UTI Relief on Gluten-Free Society, which is that D-mannose powder that you can mix with water and drink and support your urinary tract. Can raw garlic lower blood pressure? Yes. Deborah asks, just had a gallbladder removed in July, still dealing with some diarrhea, but don't know if it's due to this or possible gluten issues. Scroll down just a little bit. Doc recommended I remove gluten, dairy, eggs, sugar for a start to see if anything clears up. Looking for more solutions. Any suggestions? Yeah, I think your doctor's on track with the dairy and the gluten recommendation, maybe or maybe not the egg. Look, a lot of times, Deborah, the gallbladder malfunctioning can be a cause or can be caused by gluten. And so if you had your gallbladder removed but never really understood why it broke in the first place, you've got to reverse engineer the why. Because removing your gallbladder is not going to fix that problem and didn't fix that problem. So now, and it could be any food. It doesn't just have to be gluten, dairy, eggs. It could be a lot of different foods. So the best kind of next step is, yeah, you can do kind of a general elimination diet like that your doctor's recommending, and it's not a bad idea. I think it's a good idea, and see if you get some benefit or improvement. But ultimately, the best thing to do is ask your doctor to measure for reactivity against foods, not just those three, but also other foods, because there could be some other foods you're reactive to. Is it beneficial to take digestive enzymes if you've suffered from ulcerative colitis? It can be. Ulcerative colitis being an inflammatory lower intestine disease, one of the side effects of chronic inflammation of the intestine is a reduction in the capacity to digest nutrients from food because of that inflammatory damage. And so digestive enzymes could very well be supportive in that regard. It's not a bad idea. It may not be the whole solution, but it's not a bad idea. Didn't we do a whole piece on the gallbladder a while back? I think we did on the liver. I know for sure we have a comprehensive show on liver, gallbladder, and an article. Deborah, this is in referral to your question, because you asked about, can I talk about the gallbladder, how to deal with a gallbladder that's been removed and getting your bowels to operate better. And so this article might be extremely helpful. I think if you want the quick overview, our overarching answers, you have to ask your doctor to test you for 4 categorical things: food reactivity, chemical reactivity, nutritional deficiencies, and microbial imbalance. Those 4 things are generally the categories of triggers that can dismantle the gallbladder and lead to digestive disruption and lead to the liver damage that can ultimately leads to the failure of the gallbladder. And so you have to understand those things in order to move through it. Mary's asking, what test should I take to see what foods I react to? If you're looking for what you're allergic to, you can ask your doctor to measure what's called IgE. IgE is an egg, to all the foods that he can measure for. And then most doctors have the ability to measure for, anywhere from 40 to 100 IgE related foods. That's allergy. IgE response is an allergy. So there's allergy, Mary, and then there's sensitivity. And sensitivity and allergy are not the same thing. And where most people struggle to find an answer is not so much the allergy. Allergies are more obvious. Allergies are like your lips swell, your throat constricts, your skin breaks out in hives, or you have diarrhea. Whereas a sensitivity is a more subtle inflammatory response. It's a lot harder to detect. And so for that, we made this available direct to consumer last month. And it's called an LRA. That stands for lymphocyte response assay. And it's a test that takes your lymphocytes from a blood draw, and it basically it's measuring how your immune cells respond to different foods in a delayed fashion. There's 3 ways you can have a delayed reaction. There's type 2, type 3, and type 4 delayed responses. This test measures them all. It's the most comprehensive way to assess for food sensitivity. So you can do that via Gluten-Free Society. We can actually put that link up too for you, Mary, and you can read more about it and check it out. Question about, can I take your food sensitivity test if I'm in Canada? Lynn, you probably can. The key there would be to reach out to my support staff team and talk to somebody directly. Because the biggest issue with Canada is just the shipping, and it costs a little bit more to ship it back from Canada. But the test has to come back to the United States within enough time for the blood to still be viable to analyze. And that's the biggest drawback. But, we ship to Canada. When I deal with clients one-on-one, we ship to Canada relatively regularly. So I know we're capable of doing it. So I would reach out and talk to somebody personally on our support staff team and just let them know what your situation is. Okay, let's see. So Abdullah is asking, can you confirm if keratosis pilaris is a symptom of gluten intolerance? It can be, but there are other things that can cause it. Omega-3 fatty acid deficiencies can cause that. Vitamin C deficiency can cause it. And again, gluten can cause vitamin and mineral deficiencies. So again, there's more than one cause for it, so gluten can be a trigger, but it's not the only. I have no anti-gliadin IgG, but I think I did that one already. In my opinion, is it necessary to get a tetanus shot? Okay, let's do an audience quiz. In my opinion, Kevin, you're asking me, in my opinion, do I think it's necessary to get a tetanus shot? Let's say, audience, answer that question on my behalf, and let's see what kind of answers that we get back. So pipe that answer for Kevin into the feed. And the very first person that answers that question correctly, we're going to send a free gluten-free warrior t-shirt. So let's just see what happens. And I'll come back to your question and answer it too, but I want to do this experiment. Bonnie asks, I've been told I have a flap in my articular cartilage in my knee. Is this something that would heal on its own with regards to arthritis? Would it be better to have it cleaned up or left? I think it could heal on its own, but the rehab required is going to be intensive and it's going to be comprehensive, Bonnie. So the best thing that I would suggest that you do is seek out in your area a really, really very, let's say, how do I want to say this? Either a chiropractor with a phenomenal reputation of working on extremities. And one of the acronyms after the name of the chiropractor would be CCSP, and that stands for Certified Chiropractic Sports Physician. These guys go through a lot of postgraduate training, extra training, to understand the extremity joints and how to help them rehab and recover better. So you can look for that acronym, you can look for that acronym, or you can look for the acronym DACBO, which stands for Diplomate with the American Chiropractic Board of Orthopedists. And so again, these guys do an extra several years of training specifically for orthopedic injuries like what you're describing. And so find somebody who really specializes in the rehab of that, and that's your best chance. But surgery may not be necessary. I've seen a number of people with that same type of lesion be able to overcome it through rehab. Best way to determine if you have nutrient deficiencies, intracellular testing, Deborah. So ask your doctor to do intracellular testing. We're getting ready to, in the new year, we're getting ready to have that and make that available. Just like we made food sensitivity testing available, we're getting ready to make nutritional testing available. So if your doctors are ignoring your requests, please just be patient with me. I promise you we're going to make this available as soon as we get some of these kinks worked out.
Getting a lot of answers.
Okay, a lot of answers. So everybody's, who answered first?
Russ Moss.
So Russ, you win. The answer on the tetanus is, in my opinion, is a tetanus shot necessary? No. Tetanus is a bacteria, or tetany is a disease caused by a bacteria found in the soil. So, unless you're traipsing through muddy, dirty nails, no reason to. I've had people they got stabbed by a staple, something clean, a clean piece of metal, or they cut themselves with a clean knife, and their doctors all of a sudden want to jam them with a tetanus shot. It makes no sense, because you don't pick up tetanus off a clean knife or a clean piece of metal. Where you're going to more likely pick it up is if you're running barefoot and you scrape across a bunch of barbed wire and cut yourself up. But even then, if it were me, in my opinion, I still wouldn't get the shot, because I'm going to trust that my immune system has the capability to protect me. And so what I might do is what I would probably do is I would debride that cut, and I would clean it, and I would soak it in peroxide, and I would probably wrap it in an iodine wrap, because iodine has very powerful antibacterial properties that can protect you, and I would let the wound heal, and then let my body do the rest. Let's see. Is hyperthyroidism related to gluten? Yes. So there's a condition called Graves' disease, which is also known as hyperthyroidism. It's an autoimmune, and that absolutely is associated with gluten. I've seen cases of Graves go away when people change their diets. Juan's asking the name of the test that Dr. Sina. If you guys watched my show last week, I interviewed Dr. Sina McCullough. Wonderful woman. And the question is, what food testing did she have done? Because one of the things she mentioned in that show, if you didn't watch it, it's a must watch. You got to go back and watch it. It's such a powerful story. She was so arthritic, she couldn't really get up off the floor. She couldn't open a bottle, like she was crippled. And the food testing that was done on her, within 2 days of cutting those foods out, she was actually able to start functioning again. And I think that's probably where the emphasis of this question is coming from. So one, the answer to that question is the LRA, which again is the test that we have available to do on Gluten-Free Society. And we can put that link up as well on the YouTube side. I think we put it up on the Facebook side. I didn't see it or know if you put it up, Mel, on the other side. Will I do a show on osteonecrosis? Maybe. We'll have to put that down and run that through and maybe get one of those up. No promises. We've got our calendar already mapped out for the most part for the next 4 months, Russ. Had surgery this morning. What's your go-to for sore throat, and what's best for healing the nerve to my vocal cords? For a sore throat, I like zinc. One of my favorite formulas is called Zinc Soothe, Diane. We can put a link up to that too. That's a formula we have available on Gluten-Free Society, but it's very, very coating for a sore throat. And as far as is helping support the healing post-surgically, if you're talking about you had, you had a surgery, it looks like you had a thyroid cancer and so maybe some removal of lymph nodes or thyroid tissue. We have a post-surgery nutrition support protocol, Diane, and we'll see if we can get the link posted up there for you as well on that. Taking cholestyramine for mold, should I worry about lowering my LDL? How long is it safe to take? That's a question you want to ask your prescribing doctor more than me. I'm not personally a fan of cholestyramine for mold. I think there are less toxic and safer options to use that are equally as effective, that don't have the deleterious side effect of binding and inhibiting fat. Like cholestyramine, because cholestyramine long-term use can be linked to fat-soluble vitamin deficiencies. So you have to be careful with that. My lithium levels were low. Is that important? Yes, lithium has a lot of very important functions, and one of them is in the aid of vitamin B12. It actually helps vitamin B12 do its work. What nutrients are depleted by Butterbur PA-free? I'm not sure what you mean by PA-free. And there aren't any really known nutrient depletions with Butterbur, to my knowledge. Is there anything one can do to promote maxilla bone and jawbone regeneration where teeth that are now missing have caused decay in the bone due to infection? Yeah, I mean, the best way to inhibit bone stimulation is ask your dentist or your oral surgeon about a bone stimulator that you can put in your mouth. They're now making oscillatory bone stimulators that emit frequency currents that stimulate bone mineralization. And so that's something that you could potentially use that can be very helpful. Beyond that, nutrient testing, get nutrient testing done and get plenty of nutrients in you. But I would be on vitamin C, I would be on glutamine, I would probably be on a collagen supplement as well, just to support that. And then other things I would based on specific testing, Mario. Is there treatment of tinnitus in functional medicine? Yes, because a lot of people's tinnitus is biochemical in nature. So one of the common causes of tinnitus is vitamin B12 deficiency. Now, other B vitamin deficiencies can contribute to tinnitus as well. Gluten can cause tinnitus. Tinnitus is, generally speaking, it's inflammation of the vestibulocochlear nerve that feeds your ear. And so that's where I would start. I mean, there are definitely options that you can look into, Melanie, and so definitely a good idea to get with a functional doc and figure out what those are. Kevin asks, any chance you could have a show on men's health in the future? How many of you would like me to have a show on men's health, just general men's health category in the future? Go ahead and say yes, men's health, if you'd like to see that. And if we get 25 or more yeses, Kevin, then the answer is yes. So for all your questions tonight, we're audience polling. Most of my audience is females, Kevin, which is why I don't have a heavy focus on men. It's not that we couldn't, but I don't want to run everyone off on a topic that may not relate. So you guys give me the answer. If you'd like to see that type of show, then I'm happy to do it. Is zinc required for vitamin C to permeate the cell membrane? No. How can we prevent kidney stones, as Methodists won't do surgery on me without a jab? I mean, what kind of kidney stones would be my first question. There's different forms of kidney stone. If they've been analyzed, if you've passed a stone and collected it and the stone's been analyzed to be calcium oxalate stone, which is a very common type of kidney stone, then one of the things that you do is you have to look at going on a low oxalate diet. The other thing that you want to make sure that you have is an adequate microbiome population, especially of bifido and lactobacillus, because those types of bacteria are helpful in breaking oxalate down from your food. And then the other thing that you should have investigated is whether or not you have a yeast overgrowth internally, because yeast can actually produce oxalate. They have a biochemical pathway there where they can make oxalates. And if you have a yeast overgrowth systemically, that can lead to the formation of kidney stones. I've also seen cases where people were in chronic mold environments that they wouldn't quit making stones until they got out of the mold. So those are just all possibilities that you can investigate in that regard, Mark. We also have, we can put a link up, this is the YouTube page, we can put a link up to oxalates so you can learn a little bit more about those. We've actually done an entire show on oxalate toxicity. Do I know if Consumer Labs is a reliable place to find gluten testing for supplements? No, I can't speak for them. I can't speak for them because I don't know exactly what they're calling gluten. So if they're saying that we test supplements for the presence of gluten, what is the test that they're actually using to analyze the presence of gluten? There are different kinds of tests that different labs will run or that will order. Some of them are not accurate. Like if you're doing like a PCR test, it's junk. You throw it away. It's going to be super accurate in regards to trying to detect the gluten as a contaminated factor. If you're doing enzyme-linked immunosorbency assay tests, those are a little bit more accurate. But most people that claim to do gluten testing, they only do ELISA testing, which is, again, enzyme-linked immunosorbency assay. Those ELISA tests, they're only doing them for gliadin, so they're only really actually analyzing for the gliadin found in wheat. And so, technically they're not doing a comprehensive gluten analysis of their product. So it depends on what that lab actually is measuring, because again, not all labs are measuring it accurately or measuring all of the different forms of gluten accurately. Let's scroll down on the right. Is there a way to reduce facial fat even though someone's not overweight? Where's the facial fat at, Penny? Because that it depends on the location. I mean, you can't do you can't say you can't do spot reduction of fat, but what you can do is you can build muscle where there is fat, and you can create a fuller appearance through muscle growth in the neck. So if the fat is around the neck area, you can do, there's certain exercises and weight-bearing exercises you can do for the neck and the head itself that might give some of that appearance of spreading and evening out the face. But as far as reducing facial fat directly, where's it at? Is it a lipoma, or is it just excessive fat? Marbleizing the muscle tissue. So my opinion on NMN, which is what I was talking about earlier with all the research or not all the research, just one research study that all the news media outlets are running with, talking about Again, a type of vitamin B3 and an NMN that is now been linked in a small scale study to the possibility that it could potentially increase the risk of cancer in rodents. I don't have an opinion because that research has not been repeated, it's not been verified, and I don't know that I actually buy it. I buy it as in believe that it's accurate, and so my opinion is still in limbo on that regard. Can you make a crash course on which supplements that are safe for pregnant mothers to take to make the baby a genius? That's a great one. I don't know that I can promise or guarantee any genius babies, but Hareem, we actually do have a crash course on nutrition and pregnancy. And so we can put that link up for you and check that out. And if there's something that you can't find within that course, come back and ask me more clearly if there's a specific thing you're looking for outside of just general advice. What do you recommend on sleep for people working the night shift from 6 p.m. to 5 a.m.? It's a tough one. What I really recommend is try to get off the night shift as soon as you humanly possibly can. I know that may not be possible, and so that may not be the best answer that you wanted to hear. I did night shift work for years when I was in the military, and it really did a number on my health. And the best solution for me at the time was to get off the night shift because your body wants to follow the circadian pattern of the sun and waking up with the light and going to bed at the dark, and so you're kind of working against your body's natural circadian rhythm in that regard. But if you are on that kind of a pattern, one of the best things that you can do, depending if you're working 6 to 5s, that sounds like an 11-hour shift. And usually 11-hour shifts are done 3 days on, 4 days off, 4 days on, 3 days off, if that's what's happening to you. Try to get as much accommodation back to a normal schedule on your days off would be the best advice I can give you. Beyond that, on your days where you're having to go to bed at night, cover your windows. Get blackout curtains or something to completely cover the windows so that you can at least try to emulate night when it's day to help your body get appropriate rest and try to, again, do the best you can to try to trick it so that you can get deep and as best restful sleep as possible. Let's see here. What can I take to get rid of 2 cysts on my kidneys, which are benign? There's not a supplement that you necessarily can take to do that. If they're benign, I wouldn't lose any sleep over them, JC. Benign kidney cysts are on a lot of people and never amount to much of anything at all as far as health problems or risks. So, but there's not like something that I'm aware of that's going to dissolve that or make that go away. So, again, back to the cholestyramine. If you're taking cholestyramine to try to bind mycotoxins, prevent their recirculation, it's super important that you are out of the mold. Cholestyramine is a mold toxin binder as well as a bile acid sequestrant, and so it basically, if you're not out of the mold, you're not going to get anywhere, but you're going to take the risk that comes with taking cholestyramine, which predominantly is fat malabsorption and fat-soluble nutrient deficits, which I don't like that risk. Do I address sore throat in your surgery recovery video? Not specifically sore throat. There's a lot of reasons why people can have a sore throat. If you're talking about sore throats post-surgically because the surgery was done on the throat, then yes, because the actual supporting with nutrients is the fastest way to get your throat tissue to heal, repair, and recover. Can someone with rheumatoid arthritis take iodine 300 micrograms per day? I was wondering whether it could cause an arthritic flare. Generally, no. Some people react poorly to iodine if they have a pre-existing autoimmune thyroid disease. And megadoses of iodine over time, for some people, they can react to it because it can actually contribute to the autoimmune process at mega doses over long periods of time. But 300 micrograms is not a super high dose, and I don't think that's going to pose any major risk for RA. I've never seen a case in my career where iodine was a trigger of RA flares. Heather's asking, she says, I have the virus that shall not be named and having a lot of gastric issues from it. And now I think I have gastritis. I've also ended up with viral hives. What can I take or eat to help? I think the best things you can do to support this, number one is bone broth. If you're talking about just food to support you for the inflammation in the gut and the gastric issues, bone broth can be very healing to the gut. You can use glutamine supplementally, L-glutamine specifically. You can also, in that situation, if it's like a reflux type of gastritis where you feel like, one of the things you can use is a mucilaginous product that coats and lines the gut. It's not to heal you. It's just to kind of help support you through that as you get through that disease that shall not be named. We have a product called GI Soothe that has a variety of different mucilaginous products that might be helpful. Go back up because there's part of that question I wanted to answer there. Let's see. Oh man, there's a lot of questions left. Oh, and then the viral hives. If you this is a debate. How do you know they're viral hives? How do you know they're not some other kind of hive? Sometimes what happens with a disease that shall not be named is it can actually disrupt the gut microbiota and it can create or contribute to leaky gut. And so the hives are not necessarily viral, but they're leaky gut induced, right? Remember that viral issues can contribute to leaky gut. So the key there is really trying to get that gut to seal, which again, going back to glutamine, bone broth, and mucilaginous products are going to be your best bet. And then weathering the storm. If you're not already doing our immune protocol, it's very helpful to get people supported when they have that, right? So we can post our immune protocol up for you. It's actually over at Gluten-Free Society. We have an entire protocol that we recommend people use as a support mechanism for immune system function. I like this. Everybody gets a shirt. So you guys are having fun in the comment section. Why in your book on page 168 you say xylitol is a grain in disguise? Can one use xylitol as a sweetener? I say that xylitol can be a grain in disguise because xylitol, there's two primary ways that xylitol is made. One is through corn fiber. So a lot of xylitol is a direct byproduct of the production from corn fiber, which I do not recommend. But there's another kind of xylitol that's made from birch wood xylitol, which is perfectly gluten-free and perfectly fine. So in that case, xylitol is okay. So xylitol can be grain in disguise, but it doesn't have to be. And so that's the differentiator. Let's see here. Yeah, it looks like some of you caught on to that answer already. Looks like we get a lot of, okay, we're going to do a show on men's health. We'll put that on the calendar. Thanks for making the request, Kevin. Thoughts on mixing zeolite and charcoal for binding and detoxing? Yeah, I love the mixture. As a matter of fact, our formula Myco Binder has both of those in it on purpose. Okay, I think we're good there. I loved your vitamin D protocol of using high-dose vitamin D and now taking your liquid D. My levels went up 30 points after testing again. High five, Mary. That's awesome. I have a bit of a problem with the drops, PF vitamin D, though. I never know how much I'm actually getting. Any, excuse me, any suggestions, or is it that even a concern? It's a concern. I mean, you want to try to measure the drops, and one of the best ways to measure the drops, if you're holding it up to your mouth to take it, that can be harder because you know, depending on your peripheral vision and your ability to see what's dropping in your mouth. But what we have some people do is take that dropper and squeeze it into a spoon, and that way they can count more accurately how many drops they're getting. So that's what I would recommend that you do if you're having a hard time getting that measured. Okay. And we are, is it already 7:30? Okay, I'm 30 minutes over. So I went 30 minutes over and didn't even know it. You guys had me so entertained answering questions and so engaged. Thank you so much for playing a role tonight and being a part of the show. And thanks for spending your hour and a half with me. I hope it was helpful for you. Remember, don't forget our mission. We need your help to save lives. We're trying to save 100 million lives with real health information, not watered down and not adulterated and not bought and sold for by, you know, the people that created the disease that shall not be named. So help us share this information and hashtag save 100 million lives. So if you think this show is helpful for somebody you know or love, make sure you share the URL. Also, again, hit that like button, hit that love button, hit that subscribe button. And if you want more reminders, if you want to get on our emailing list, make sure that you head over to glutenfreesociety.org and sign up there. That way you'll never miss a beat due to censorship. They don't censor my email list, but they can censor these channels that we play on. So, and they do. So if you don't want to be censored, come join me over there on my own platform where we can speak freely and not have to worry about the powers that be trying to control our message. Hope you have a fantastic Thanksgiving, and I hope it's blessed, and I hope you enjoy the time off with your families and loved ones, and we will see you back next week, regular time, Tuesday at 6 p.m. Central Standard Time, and Thursday for live Q&A at 12:30. Take care and have a great Thanksgiving.